that we are here on Monday morning. Mondays are always my favorite day of the week, and I know most people dread Mondays, but I love my work. I love what I do. I I get to interview people like Dr. Melissa that you see here with me today. She's a member of the LEAP community, and therefore I bring my members forward. I interview them because they have so much knowledge, they have so much to say. And today, Dr. Melissa is going to talk to us about medications that you have and you maybe are taking. It could be supplements, could be medications that are killing you. I'll give you a secret. She told me one time before I was taking turmeric. She said, make sure you're taking that with black pepper. And I said, oh, that's so interesting that you say that because the little shot that I take has black pepper in it. She said, yeah, you want to make sure you take those together. Something I did not know. So we're going to get a lot of knowledge from Dr. Melissa today. She is a pharmacist. So I'm going to give her a chance to introduce herself, tell you a little bit about her and why she does what she does. So Melissa, welcome to the show. Please introduce yourself.
Thank you so much, Colleen, for having me. It's an honor to be here. I'm so excited to be able to give you some secrets today on things that you may not know about your medications that may be killing you. And I can tell you that with over 52,000 clinical hours, I have helped thousands and thousands of patients change their life, get off of medications that weren't necessary for them, get rid of things that were causing them horrible side effects. And your physician prescribes lots and lots of medications, and we always think that your pharmacist is the drug dealer. Well, we're just the ones filling those orders.
Right.
So your physician doesn't have as much medication knowledge as your pharmacist. Your pharmacist is your medication expert, so you want to ask your pharmacist. And so I'm honored to be here and bring to you my knowledge that I have of both the Eastern and Western medicine, which includes those supplements, which are not always safe for you.
I'm glad you said that. Your pharmacist is your medication expert. How many of you out there think that your pharmacist is the only one that's dispensing, like Pez dispensing the drugs, but your doctor is ultimately the one that knows what it is you need to take? And I just want to caution everybody on that for a moment. I'm sure I'm going to get some backlash on this, but I don't do anything without controversy, so that's fine. Your pharmacist is the one that has gone to school and only studied medications. You know, your doctor has studied many other things, right? So that's why they're in a guide on this as well. But don't you think that if you have a doctor, that you should bring a pharmacist into the mix, Melissa, so that that pharmacist can share? I mean,
Absolutely. Yeah. Yes, I have some of my favorite physicians have pharmacists at their sites. They're the ones utilizing their resources, which is what we all want to do. We want to utilize and do our strong suits and then pull in the resources. So I work hand in hand with physicians. They ask me questions. We get the right medications since they're necessary at times, and we get you on the right medications. Having that pharmacist and physician in your healthcare corner is necessary.
Yeah. Let's talk about symptoms versus root cause. Many people don't know the difference of these two things. So, what's happening with the doctors when you go into the doctor and something's wrong? Kind of walk us through that pattern of what we see people do. And everyone listening today has done this at some time in their life, including me.
So, let's take dizziness, for example. So,
Okay.
dizziness is a symptom, okay? And you go in to see your physician because you're dizzy, okay?
Yes.
Well, you may not remember, your physician may not remember, you may have gone to a different physician. 4 months ago, you may have been put on a new medication to help control your blood pressure. Okay. And all of a sudden, you're experiencing, and it could be all of a sudden a week, 2 weeks, or it could be 4 months later, as in this example. And so 4 months has gone down and you're dizzy. You don't know why you're dizzy. And when you're just treating the symptom, your physician, whoever you go in and see today, is going to give you another medication to help you resolve that dizziness. Okay, so that we're treating the symptom. But if
Yes.
we actually look at it, we want to get down and treat the root cause. So we want to figure out what is causing that dizziness. Okay. So we go back and we look at 4 months ago, you started a medication that can
Mm.
make you dizzy, but it's been 4 months. So you think, oh, it's no big deal. But really, in this example, that is the root cause. Now, you're on that medication for a purpose. So we can't just stop that medication because that would be detrimental. That could kill you. But what we want to do is there are many, many options out there. For example, on this high blood pressure, we can try you on something different that
Mm.
doesn't cause that symptom.
Ah, so you're talking about two different things here. So there's the root cause of why you have high blood pressure, right? Let's say just for instance. So why do you have high blood pressure? You need to look at all of those factors that's causing the high blood pressure. Could be lack of exercise, lack of movement, what you're eating, your environment. I mean, it goes on and on and on, right? It could be other things that you're prescribed, right? So then you get dizzy because there's a medication that's causing the dizziness. Now they're giving you a medication to treat the dizziness. But what if we just got all the way back down to what's causing the high blood pressure and solve what's causing the high blood pressure and eliminate the high blood pressure? You would eliminate all those side effects, eliminate all those pills. And I'm sure there's got to be supplements out there and maybe one medication that you could take that could help you get to the point where you don't need any of it at all. I'm sure that
Absolutely.
exists, right?
Absolutely. That that
Yeah.
that does exist. So there are like supplements. So grape seed is a very good supplement to actually reduce your blood pressure. You got to make sure you got the right dose. You need at least 200 milligrams a
Yes. So
day.
disclaimer, no one just go out and run and get grapeseed. I want you guys to contact Dr. Melissa. She has a link here, askdrmelissa.net. You go to askdrmelissa.net. She has a place for you to sign up where you can book a call with her right away. So please do that and don't go out and just start, eliminating your medications. This should be under the supervision of a doctor. So that's why we're having this conversation today to show you what's possible. But please book a call with her. Go ahead, Dr.
Thank you.
Melissa.
Absolutely. Yes. Because,
Yeah.
for example, that supplement can interact with other supplements that you're taking. It can interact with your other medications that you might be taking. And yes, we want to get down to the root cause of what is causing that high blood pressure, that dizziness, getting back down. And let's go an example of what could be. So we go all the way back, and it was anxiety that caused it was anxiety. You got put on an anxiety medication, which then caused your high blood pressure, which then caused your dizziness. So now we're 3 layers in. Okay. And if
I'm
you
sure
don't,
you see this all the time,
I do.
Melissa. Oh,
I
yeah.
do. And that's why I
Yeah.
wanted to go through that example, because I do. I see that exactly all the time, especially with women, busy professional women,
Yeah.
which you're who is watching right now, and that's the key. So that's the scenario. So that's 3 layers thick. So there's different things that we do to help control the blood pressure, to help control the anxiety, so that we can get rid of that anxiety or have other mechanisms besides just being on it. The other thing is, with that anxiety, so many of my clients have come to me because they've been put on an anti-anxiety medication or an antidepressant, um, and their physician said, "Oh, it's okay for a short time," or "It's okay." Well, then their physician retires, and then the next physician just keeps prescribing and prescribing. They're like, "I want off of this. It's been a year. It's been 5 years. It's been 10 years." Yes, you can get off of it. Please contact me because we need to do it
Yes.
safely.
Yeah. I think that's the big thing that we need to remember is that you want to do it safely, right? You want to do it safely. So, what Melissa's sharing today is, I learned through this process and working with Melissa and several other people is, I was taking an antibiotic that they had put me on when I got sick. Like I had a flu, they didn't know what was going on with me. They gave me an antibiotic and I take a probiotic every day. How many of you take a probiotic every day because someone in your life has told you to take a probiotic? You don't know why you're taking it, you just take it every day. I know why I'm taking it. I've done blood tests, I've done the blood work, but I'm taking it and didn't realize that while I'm on an antibiotic, if I take a probiotic, it's canceling out my antibiotic. I had no idea. How many of you didn't know that, right? we don't have the knowledge of physicians or pharmacists to understand that we need to ask these questions. And I kind of wonder, like, if I would have asked my physician, because he never said, "What are you taking right now?" when he prescribed me that antibiotic. And that's not good. Like, I just totally deleted and canceled out that antibiotic that my body needed at the time, because he didn't say, "What are you taking right now? What are you on? What are you taking?" He just prescribed it to me. And I just started taking it, thinking that it was safe for me to take that. How many times has this happened to many of you out there? You're taking medications, another doctor prescribes something, or you're taking supplements that you think are safe because I can buy them. And then I take something else and I find out it's counteracting with it. And then I wonder why I have bloating, or I wonder if I have weight gain, or I wonder why I'm lethargic, or I can't sleep at night. All of these things happen because we are not paying attention to what we think what the doctor's prescribing us is okay. So, Melissa, we have to break this myth. It's not true. It's not true. How many times have you caught things at the pharmacy that doctors have prescribed and you're like, "Oh, hey, you're taking this and this," and then you have to go back to the physician. And I'm not saying physicians are wrong. That's not what I'm saying, but that physician never asked me what I was taking. And if I
Right.
hadn't asked you, I never would have known what was going on.
Absolutely. I catch, so working in pharmacy for so many years, and I catch at least one mistake every single day, at
Mm-hmm.
least one, if not more. And that is a check because I catch it before it got to you. Okay. But it might not have gotten to, it might have been missed if you had just
Yeah.
gotten a sample from your physician. What, you wouldn't have had that check from a pharmacist.
All right. That's right. They do give you samples sometimes to save you money. And they're like, "Oh, we have these in the office. You can just take those." So, what are you suggesting that people that are watching this do? Because I'm instilling a little fear now, which I'm kind of hoping it's working. What you're putting in your body matters. Maybe I should just say that, right? If it's a
Yes.
supplement or a medication, you need to have somebody in your corner, like a pharmacist, that knows medication. That's their job, is to know medication inside and out. So, I mean, I've told this story in the past. I got really sick. They gave me a whole bunch of Zofran. I was throwing up. No one knew what was wrong with me. They gave me, I had about 3 IV bags in 3 days, a whole bunch of Zofran. I contacted Melissa and I said, "I've got these sores all over my body. I've gained like 8 pounds this week. I haven't eaten a thing in 4 days." Melissa said, "Don't worry about it. The IV bags, that's what's causing all the weight gain. It's just water. You'll just pee it out," right? I was like, "But what is going on with these sores that I have?" The doctor couldn't figure it out. And she said the Zofran is just trying to, they probably overdosed you on Zofran, is trying to get out of your body, and it will come out any way that it can. So pores, that type of thing. So I could relax a little bit and not think now I had something else wrong with me. When the doctor took a photo, looked at it in person, and couldn't figure it out. And Melissa knew what it was. And I didn't even have to send her a photo or anything. She just knew what it was immediately from what I had taken. So you need someone like Melissa on your side because of this, because I don't trust what other doctors are giving me or saying, because I've had too many discrepancies now and I don't want to die because the doctor prescribes me something I'm not supposed to have. So what
Absolutely.
advice would you give someone out there?
So I would say question things. Okay. And if your physician says, "Well, I don't like to be questioned," you should change physicians because they're going to either give you an answer or they're going to say, "Hey, I need to look that up," which is a good answer. Okay. If they need to go and look it up, that's a good answer. They're
Yeah.
going to consult your pharmacist because they're a medication expert, which is good. That's a good referral for us. But you want to ask yourself when you're going in, have an open mind, is this the right thing for me? What can happen? There's many different questions you want to ask, side effects, different things. And I actually I threw the link in there, the last one that has a sheet for you. If you want to know
Ooh.
questions that you should ask before starting, this would be questions you ask your physician or questions you ask your pharmacist. There's 5 questions that come off the top that you want to know and you want to ask. Okay. So you can go and get that resource for you. You can book the call with me and ask me right away. But those are things, side effects, interactions. These are big things. Is it, supplements that you're taking? A lot of us go to many different physicians, and our physician does not have a record of every different place that we go. So I would give you one tip: when you are getting prescription medications, go to one pharmacy, get everything at one pharmacy, and then your pharmacist can check for interactions. Now, unless you talk to them, they're not going to check against your supplements or your over-the-counter medications. So that's something where you need to have somebody, you need to have me in your corner as well.
Yeah. So Melissa just gave a free resource, drmelissabalizan.com/TV. She's saying download this resource because this resource is going to give you the questions that you need to ask your physician. Remember, your physician is not the drug dealer. The pharmacists are. So they are the ones educated in the drugs. Stick with one pharmacy was her other piece of advice. Stick with one pharmacy so that all of the medications that you have can go to one pharmacy. Have the conversation with the pharmacist there. Tell them what you're taking over the counter, any supplements, what you have going on. That way, they know if what you're taking is causing any of these side effects or if they can manage all of that for you. And, I love Dr. Melissa because she works with so many clients outside of, I would say, Western medicine to manage what they're taking to help them implement some more supplements of the Eastern medication, which let's go back thousands and thousands and thousands of centuries. Eastern medication has been the way to solve any, illness. Now, I'm not saying if you're in a car accident, your guts are hanging out, you shouldn't go to the hospital. That's not what I'm saying. I'm saying that if you can work with a pharmacist who knows everything about medication, supplements, Eastern and Western, both sides, why not work with them if they're able to solve the problem with you rather than going to a physician who isn't possibly going to have that same knowledge, right? And I'm more of a root cause type of person, so I prefer to get to the root cause and eliminate forever, not just treat, but eliminate, so it never comes back again and you can move forward with your life. So Dr. Melissa, other than your resource guide, what's a secret that you can tell us today, or a client that you worked with, something that everyone needs to know?
So something that everyone needs to know. Yeah, let's see. That's a great one. All supplements are not created equal. That would be something that I think that you need to realize, is that even if you walk into the pharmacy, that pharmacist is going to tell you not to buy what's on the shelf. Okay, because it's run by store management. It's run by store management. They don't have a say in what's there. It's the cheapest stuff. You don't know what's in it. So you look at the bottle and you don't know that it has fish oil or garlic. It may not be in there. Mm-hmm. So you want to get a good quality, high quality supplement. So you need to find somebody you can trust who has.
Dr. Melissa's a good one. I trust her.
Like me, that's vetted out companies and can give you a good resource.
So you guys, we went through a lot today. drmelissabalizan.com/TV is where you're going to get the information to download the resource of what you need to ask your physician. And then Ask Dr. Melissa is where you can get a link to book a call with Melissa so that you can ask her about the medications your doctor has you on or the supplements you're taking and you don't know why you're taking certain supplements. I was taking fish oil for the longest time because I heard that omegas and the fatty omegas were good for me. And when you take those, it lowers your chances of having fat consume like around your midline. I'm serious. That's what I read. And I was like, well, I'm going to take that every day. I had no idea why I was taking it, if my body was low on fatty omegas or not, right? And I eat a lot of fish, so maybe I wasn't. It wasn't until I did my blood test. So she can work with you on getting blood tests, doing everything that you could do like a physician inside of a physician's office, but you can work virtually with Dr. Melissa. And she's a pharmacist, so her knowledge is crazy insane. So thank you, Dr. Melissa, for being with us today. And if you guys really enjoyed this and you want to find out how you can be a guest and be interviewed on a LinkedIn show like this, all you have to do is just go to our community link, look up our community link, join the community, and get the chance to step into the spotlight to expand your influence and attract the right clients to you, like Melissa is doing today. She's attracting the right clients that need her, because not everyone is on supplements. Not everyone is on medications. Not everyone is dealing with something in their life that they need a pharmacist in their corner. But those of you that are, then you need to get out there and do that. And Agnes, thank you very much. She said, congratulations on empowering us. My health is my responsibility. So thank you, Agnes. It is your responsibility. And Melissa gives you the tools to be empowered about your health. So thank you, Dr. Melissa, for joining us today. Until next week. Oh, and happy holidays on Memorial Day. We will not be here next Monday. I'll be visiting family in Utah. We will see you all next time. Thank you so much. Bye-bye for now.